I'm really angry about what the government are doing to us NHS staff on pay, because 1% wouldn't have been enough. 1% wouldn't have been enough for me to keep up with my bills, for the people that I work with to keep putting food on the table for their kids. But to not even get that is an absolute insult, and it's a kick in the teeth for hard-working staff.
I'm angry about the government's pay announcement because I feel totally undervalued. For 3 years now we've had no pay rise and now we're still struggling to make ends meet. Things are getting far more expensive and yet other people seem to be in the bigger, higher minorities. The government itself have given themselves a big pay rise, but I'm not valued at all for the job that I do.
I'm not just angry about it, I'm absolutely livid. They're telling me that I'm not worth 1%. They're telling me that I'm not worth recognising for the hours that I do, the work that I do, and the work that my colleagues do as well in delivering the NHS for them. It's had a massive impact on both myself and my colleagues. We're talking about low-paid workers who can't afford to get the bus into work, who are having to walk to work because they can't afford the bus fare to get them there. And they're seriously thinking about, is the NHS the role for me? I can work in Sainsbury's and earn more. I can stack shelves and earn more. What's the point in staying in the NHS?
And the 1% pay rise becomes a pay cut to me because I have the way the cost of living is, the fuel's gone up, food's gone up, all bills have gone up. So in my view, it's a pay cut.
I'm angry because I'm dedicated to NHS services, put day-to-day commitment into running services on behalf of NHS and the community. And this is just totally unfair and falling behind. Yet again, 10% cut over a number of years now, and this is just exacerbating the problem.
I think UNISON members are incredibly angry about what the governments across the UK have done in terms of NHS pay. So it's been 1% in some parts of the UK, but in England in particular, where the government has basically decided to say it's a pay freeze for the next 2 years, and those at the top of the pay band will only get a 1% non-consolidated for 2 years. And this seems to me to be a deliberately provocative attack on NHS workers, where basically the Secretary of State is saying, we haven't funded the NHS properly, we now expect staff to pick up that shortfall by taking a further cut in their pay. I've written twice to the Secretary of State, once in my role as the chair of the NHS staff unions, so there are 16 unions, and I've written on behalf of all 16 unions, telling the Secretary of State how angry people feel about it and how angry we are about the way he announced it and the kind of attempt to conflate incremental pay with a cost of living increase. But I've also written to him on behalf of UNISON, as Head of Health in UNISON, where we've said we're calling on him to pull back from the brink because we think this is probably the most serious attack there's been on NHS workers. And our members are angry, they have reacted to it. We're doing a consultation at the moment through branches. We expect to have that result just before Health Conference, and I'm pretty confident that members will be saying to us this enough is enough and that he's pushed us too far this time. The Health Executive is taking an emergency motion to UNISON's Health Conference next week, and that motion is calling for a sustained campaign to improve pay for NHS workers. But as part of that, the SGE is asking conference to agree that we will request a ballot for industrial action, for strike action and action short of strike action. This will be if this goes through, this will be a long-term campaign. This is a campaign that will take us to the general election and beyond. So this is not a quick fix. We know this will be a long fight. We'll be in this for the long haul, but we think it's worth it because this is about defending NHS pay, but also about defending the NHS.